Why did your doctor request a urine culture? Have you ever been asked to do a urine culture test and wondered why your doctor didn't just request a normal urine test? Although these two tests are urine samples, they are very different. Understanding the difference can help you appreciate why this test is so important in diagnosing infections. A urine culture is a laboratory test performed to determine whether bacteria, fungi, or other microorganisms are growing in your urinary tract. Unlike a routine urinalysis, which checks for things like protein, glucose, blood, or white blood cells, a urine culture is specifically designed to identify the exact organism causing an infection. Doctors usually request this test when patients experience symptoms such as painful urination, frequent urination, burning sensations while urinating, lower abdominal pain, fever, foul-smelling urine, cloudy urine, or even blood in the urine. These symptoms may suggest a urinary tract infection, commonly known as a UTI. However, symptoms alone cannot tell the doctor which microorganism is responsible. This is why a urine culture becomes necessary. To obtain the most accurate results, patients are usually asked to provide a clean catch mixture urine sample. This helps reduce contamination from bacteria normally found on the skin. Once the sample arrives in a microbiology laboratory, the medical laboratory scientist carefully labels and examines it before placing a small amount of urine onto special culture media inside sterile petri dishes. These culture plates are then placed inside an incubator at the appropriate temperature for about 24 to 48 hours. During this time, if bacteria and fungi are present, they begin to grow into visible colonies. After incubation, the laboratory scientists study these colonies carefully. Different microorganisms produce different colony appearances, which provide important clues during identification. Additional laboratory tests may then be performed to determine the exact organism responsible for the infection. But identifying the organism is only part of the process. Another equally important procedure called antibiotic susceptibility testing is then carried out. In this test, different antibiotics are tested against the microorganism to determine which medication can successfully stop its growth. This information is extremely valuable because not all bacteria respond to the same antibiotics. Prescribing the wrong antibiotic may delay recovery and contribute to the growing problem of antibiotic resistance around the world. By identifying both the organism and the most effective antibiotic, doctors can provide treatment that is more accurate, effective, and safer for the patient. It is also important to remember that urine culture results are not usually available immediately. Since microorganisms need time to grow, patients may now have to wait 1 or 2 days before final report is released. Although waiting on can sometimes feel frustrating, this extra time allows the laboratory to provide precise and reliable information that helps guide the best treatment. The next time your doctor requests a urine culture, you will know that it isn't just another laboratory test. It is an important investigation that helps identify the exact cause of infection and ensures that you receive the right medication. Understanding your laboratory tests helps you become a more informed patient and highlights the vital role that medical laboratory scientists play in healthcare every single day. Thank you for watching. If you enjoy learning about laboratory medicine and healthcare in simple, easy to understand language, don't forget to like, share, and follow Victor C.C Hub for more educational healthcare content.